When you come into our institute, how many patients are there in the lobby when you arrive? Nobody else. Only you. And yet, day after surgery, how many of you are leaving? And all of you are from all over the world. So this is things that I really want to imbibe, I want to share with our colleagues. This is how I want medicine to be. And none of you are ordinary people. None of you came across from the street for some advertising. You all have researched. You'll have stalked me, all of you, right? For years before flight. Oh, I know all of you. All of you know everything. But again, such a pleasure. Many of you are doctors. Many of you are nurses, attorneys. All of you from different parts of the planet, different cultures. All of you very complex scenarios when you come here, but still, can I give you all the same amount of love and fight? And my pleasure today, my daughter's here. She's gonna be an eye surgeon, so she's witnessing how yesterday we operated for 12 hours, one by one, but did any of y'all feel rushed? No. Did any of y'all miss me anywhere? I was just too much around you. That's a pleasure. And then also caring, because y'all have come with many issues and you'll have all got the same story. Nothing can be done, or complications of other surgeries. So this is great. Y'all are sitting here impromptu. Nobody gets a Starbucks card. And y'all are sharing your story, but keep it short, because about like in your case, 9 surgeries, whatever. And then how y'all are feeling, or how the planning, and how y'all are coming together, because I believe that everybody has a simple bond of vision together. It transgresses religion, cultures, and countries, right? One by one,
I'm Sonia, and I was a boat captain for many, many years, oil and gas industry off Louisiana and Texas. So I worked all with men, and then I decided to come home, so I became an RN and worked as a nurse. I had RK surgery probably 20, 25 years ago at the Berkeley Institute in Houston, and saw great. I have really bad vision, so couldn't hardly make out the big E with my right eye. So I did that, and then after so many years it started going bad. So went to many eye doctors, and a lot of them couldn't correct me. Went to Miami, said I had a keratoconus, which I did not. So I had that baked B vitamin in my eye, which stiffens your cornea pretty hard. And then tried to wear a sclera lens for years, and that was just impossible, because from RK surgery you get very dry eye. Then from there, saw another doctor in Fort Myers, tried to clear up the scar tissue. He made it worse, and couldn't find a doctor that would help me. Went to Bascom Palmer, they don't see RK patients. So finally came here, found it online, researched the internet a lot. Dr. Gulani is a wonderful surgeon. Like he says, you don't wait at all. You come here, you feel like family. Nothing hurt, and I had LaZrPlastique first, to where I became measurable, which that means my eye then became to where it could be measurable when you have a refraction. Before it could not. And then just got done having LaZrPlastique, and I'm very thankful for Dr. Gulani and all my experiences that I had. This has been wonderful. Probably one of the best doctors I've ever worked with. I've been in the medical profession for the past probably 6-7 years, and never have met a doctor like him. This was just a wonderful experience.
My name is Jackie. I'm from Iowa. I had RK surgery back in '93, and I work in the healthcare profession also. And basically, after researching, I came across Dr. Gulani. We came down here, met with him, and he gave me hope again to be able to see without having a huge vision correction in glasses. And so we went ahead and decided to go with LaZrPlastique. Since I was near the age of cataracts, he replaced the lens. And so I'm here today for my second eye, and he completed that yesterday. And so far our recovery is going great.
And I'm Vicki, and I live locally. My husband and I are both in the medical profession, and have heard wonderful things about Dr. Gulani, and that's why I came here for my cataract surgery. Have not seen any other doctor for that, but just came straight to the best.
I'm Chanel, and I live in the Virgin Islands, 3 small islands next to Puerto Rico. And I came here for what they call a pterygium. It's commonly called surfer's eye. So a lot of people that work outdoors, golfers, surfers, My background's marine biology. I did that for a decade. So I spent a lot of time on the water doing research. And then I started my own pet care, dog walking service. So another decade of outdoor work. And the growth that I had on my eye just progressively got worse. And so after I couldn't deal with it aesthetically, I did my research, found Dr. Gulani. I said, wait a minute. And by the way, we only have like one ophthalmologist surgeon for all 3 islands. And he was using some procedures that I thought wouldn't be best for me. So I came up here and I'm very happy with my results.
Hi, my name is Simpson. I'm from New York City. I'm a software engineer and data scientist. I suffer keratoconus in both eyes, and one of them is the left eye is the worst one. I happen to know Dr. Gulani from a friend of mine. He's a doctor himself. When my left eye done, I can say blindly, because what they call corneal edema. That's the worst stage you can expect for your eye. I was very depressed, and that friend of mine is also my business partner. He advised me to see Dr. Gulani because after I've seen so many doctors in New York City, some top doctors in New York Presbyterian Hospital, NYU. If one of you guys familiar with those hospitals, you know exactly what kind of doctors they have over there. And none of them could actually offer me something, except they cannot do anything. Just when I get older, if the contact doesn't work anymore, and then do transplant. That was my only hope. And I begged them so many times actually to do something. They say no, there's nothing they cannot do. And at one point when that left eye gone down completely, I was very depressed because I see I'm about to blind. And fortunately, my good friend advised me to see Dr. Gulani. He told me whatever Dr. Gulani asked me to do, just do it without asking any question, because he's a fearless doctor and he's very caring. And to tell you the truth, guys, I'm living a dream. To sit down here when that TV was on, I can see things in the TV. On my way to come here, I told my wife, oh man, I see the banks, I see things. It's unbelievable what I'm living right now, and I know it's just the beginning. And thanks to Dr. Gulani, and hopefully so many people will know the truth about keratoconus.
Hi, I'm Madeline. I'm from Michigan. I'm a pastry chef and stylist. I had a reoccurrent pterygium, and the doctors I talked to told me they didn't want to touch it, they didn't want to operate on me. They said just to leave it alone. And so I looked up Dr. Gulani online and looked at all his reviews and his other patients, and I was like, I should go see him. And he's a great doctor, made me feel so comfortable. My eye looks so good and feels good, and I'm super happy that I came here.
Hello everyone, I'm sorry I lost my voice. My name is Maya, I'm a pharmacy manager. I met Dr. Gulani when I was in high school. I got a really bad eye infection from wearing my contacts all the time, and I almost lost my vision then. My primary optometrist, he said come straight here, because at that point my eyesight was almost gone, and when you're 16 years old you don't want to lose your eyesight. I come here, got that straightened out, but I had a lot of scarring. The scarring was so bad that my right eye was really affected. I tried to get corrective eye surgery then. Again, our doctor kept telling me no, because of the scarring you can't do it. So about 5-6 years, and we keep going back to different eye doctors, seeing what they can do, if they can refer me to someone who can correct my eye. My mom said, come back to Dr. Gulani, see what he can do for me. I came back and he was able to tell me of different options I had available. So now I'm here. It feels good at the moment. I'm just ready for the next eye. I'm impatient. I'm ready to get both eyes so I can see and be on my way. Again, like I said, I am a pharmacy manager, so I use my eyes all day long. But other than that, I am very ready to see what my, I guess my results are going to be.
My name is Chitra. I'm in a medical profession, and I knew that I have a cataract, but I kept postponing. And as one day I got a lecture from Dr. Gulani that why I'm waiting, and then I just came in and got my cataract removed on one eye, and I'm doing good.
My name is James. I live here in Jacksonville. I'm in the IT profession, so I sit in front of a screen, all day. And I've got very nearsightedness, and I had it all my life. And this is my first surgery or anything done to my eyes. Luckily, I had a bout with dry eye about 5 years ago, and I came here and Dr. Gulani helped me with my dry eye. So when I got to the point where I just was ready to do some corrective surgery, of course I came back to Gulani because I knew he was the best around. And so I did the LaZrPlastique since I'm 48. I'm close to getting a cataract. I think he saw a little bit of cataract in there. So he just went ahead and took the natural lens and put in a permanent lens to correct my vision going out. He did my left eye, which is my non-dominant eye, and I'll come back in 2 weeks and he'll do my right. No pain, everything seems to be very well.
My name is Mary. I drove up from Mount Dora, Florida. My background is also IT, and I was in the military. Had RK surgery in 1989, and no other, had problems about 2 years later, but never had any other additional surgery till Dr. Gulani did my first eye with LaZrPlastique yesterday, and we'll go forward from there. Maybe, for sure the right eye will have the cataract surgery, and then maybe LaZrPlastique later on. Like a lot of you doctors, for years can't do anything, not going to do anything, or wait, we're going to get a new machine, we're going to, it's like a carrot. And then finally, like everybody else, found Dr. Gulani online, stalked him on YouTube, called and got a appointment in November, and here we are today. So very happy. I would recommend him to anyone, and don't wait. Your vision is everything.
Being Madeline's mom, I've had RK, and I'm listening to all the RK people thinking I need to come make an appointment now. So I'm glad she found him so I can come find him.
Don't wait.
I won't.
Again, guys, thank you.
Thank you.
Like I said, it's become my calling. But the second calling is what keeps me awake, is I want other doctors to become like this. I, in fact, have a very, very altruistic goal. I don't want y'all flying to me. I want your doctors to take care of this. And I want them to rise and fight and bring back the valor of doctors. They've lost their position.
Yes.
They completely lost the reason they became doctors. Complete clowns. From looks to brains to ability.
Yeah.
And I'm here to change it all. They're doing, no, it's important, Chanel, right?
Hey, don't drag me in this.
Important, and you'll find this really funny. When all these people are now doing autobiographies on me and trying to write books and trying to make movies and stuff, and I'm still like, let me die first. It came to me, they said, Doc, why did you become like this? I said, very simple. I don't know how I said this to them, impromptu, in an interview. I said, in movies they always show the doctors as wimps. You remember this? They always have spectacles, they're half bald, thin arms, concave chest, they always come out from the OR go, I'm sorry. So I don't know where that hit me as a child. And I'll be completely out of it. I will make sure there are results and then let the patient hug me. Why are doctors so distant? Why are they afraid to own up? So anyway, this is and my life's calling it's become. It's very risky, think about it. None of you are ordinary or predictable cases. None of you. Yesterday we got the patent on LaZrPlastique. I want to refuse people who call it cataract surgery. Cataract surgery, you made a burger, you're not a cook. You made a burger, excuse me. Master chef. So cataract surgery now will be called LaZrPlastique, maybe 50 years after I'm gone, but patent came in yesterday. So now all of you are part of my story, my life story, because this is not about medicine what I do here. If I had to make money, I'm the world's greatest and fastest eye surgeon. I could just put my face on a billboard, everybody out of business.
Yeah.
It's so simple. Imagine the power I carry. And yet every day I pray to God, keep my feet on the ground. Pardon me? Yes? Yes?
This is the patent.
That's the patent, you're right. That's what you had, Dr. Kutiala. LaZrPlastique, that's the patent yesterday. So,
Took a picture of it too, from the announcement.
but you know, this has become, James, all of you, Sonia, all of you, because each one of you could have gone blind yesterday. That was so dangerous. And the best part, when you go back to your doctors, they have no idea what I did. They go, oh, he did cataract, what lens did he use? Or they look at Maddie and go, where's the stitch? He forgot a stitch. Until you explain, he doesn't take a stitch. And then patients are used to coming out on stretchers, half dead, confused. Next day, optometrist sees them. This is Dr. Gulani all around you. Important. But, you know, that's why I look at you all only for advice, because I'm a horrible businessman. I don't care about my time. If you see today, what have I done for the last 3 hours? I could have seen you in 1 minute and said bye-bye. But the love that I have, because you're all my Mona Lisas, it's important. So I literally look at y'all, Ricky, Mary, all of you. Y'all are the ones I listen to. Y'all can teach me, Dr. Honey, you need to do this way. And I listen. I don't listen to anyone else. Marketing people come here, they go nuts by 5 p.m. Dr. Honey, where's the secret? Where's your marketing team? Oh, there's none. There is none. Don't you see? You got someone hiding here. Where are they? There's nobody. Nobody. It's one patient at a time. So it's so important, James, all of you, and y'all are the ones spreading the story because, and like I said, you cannot guarantee anyone's outcome, especially for cases like these, where 100% of y'all have either had bad surgery or are impossible by the book. Does that make sense? And yet, you know, my patient last month gave me this gift, a USS carrier. I didn't know this. He's an officer in the Coast Guard, and he said he was an RK case, real cataract, very complex. He was flown in, and he gave me a USS Gulani. He called it. He gave me a little model gift. He said, "Doc, you are doing what I used to do, which is impossible. Turning an aircraft carrier." I didn't know that was difficult. He said, "That's what you're doing for medicine. It's nearly impossible, but you'll succeed one day." So that, James, is my thing. It's not only about seeing y'all today and feeling so nice, Jackie, all of you, but I feel for y'all. Y'all are traveling from far, far away. Y'all are coming in confused. Y'all are Googling. You don't have to Google. The doctor should be explaining. Right, Hannah? Anyway, giving you a lecture. Been a pleasure. Come with me. We'll have fun. It's Jackie's birthday, so I got a cake early morning. We'll do that too. Come on, all of you. Come on. Come, please. This way. Come, everybody.
Thank you.
Come. Come this way, please. And you're flying back to Michigan Saturday, right? Come here. Y'all are in New York on Saturday?
Yes.
Yeah. Come on. Please. Come this way, please. Mia, come. Chanel, you're leaving on?
Sunday.
Sunday. Come this way, please. Come. Pleasure, all of you. Come this way, please. Birthday girl.
It did snow last night at home.
It did, and you're glad you're here, huh? Not in Iowa.
I know. It snowed like 3 inches.
Send them a picture from here. Say, God, it's scorching hot.
I know.
Been in New
Careful.
York and
Yeah, give us some time.
yeah, been in
Come.
Denmark and his kids as well, Rahul and Abhijit.
Okay, please go ahead from my back because it will take me a while.
You know what you just did, educating the patients. I had a patient one time that I had a letter from an insurance company. She had multiple sclerosis. The insurance company wanted to stop her treatment.
Oh.
And I said, well, you ever think that maybe the treatment is why you're not having any more problems?
Amazing, doc, amazing. Really. Come.
It's educating.
Yeah. You're leading on. What they go? You're glad you're here, huh? Not an hour.
These kids as well, I really have to-
And put it back on yet. I don't want to put it back on.
Maybe the treatment is why you're not having any more problems.
It's amazing, doc, amazing. Really. Yes, you will now. I love it. Come on, come on. Cut it like an arcade, just like your eye. Come on, guys, come closer. Come closer, all of you. Come around there. Come on. I want you to support each other.
Happy
Come on.
birthday to you.
Happy birthday to you. Happy birthday, dear Jackie.
Happy birthday.
Happy birthday to you.
Make them uneven.
Fish. There we go.
There we go.
Not too deep.
95% depth. Arcade.
All the way through.
My pleasure.
Thank you very,
Absolutely,
much.
absolute pleasure, guys.
Appreciate that.
Can you imagine this is day one with all of your surgeries? And you got to thank my lovely wife. She and me went early morning to get this. Happy birthday. Good for your eyes.
Thank you very much. It's like when you get married, piece of cake.
Come on, do that. Give her some. Come on. Here we go.
Thank you so much.
Take this one. Take this. Take this.
That's very good. Thank you very much.
I made it last night. I'm kidding.
That's really good.
Aisha, it's such a pleasure to have my daughter here today. Aisha's here. Come on here. Oh, hold on one second. Hold on. Stay here. You feeling you want water?
There was a strike with the workers in the rum punch was good.
I'll hold the cake for Jackie. How's that?